This is a video on how to perform a passive voiding trial for urogynecology patients. If the patient has a foley catheter, ensure urine output has been adequate while the foley is in place. If urine output is less than 30 milliliters per hour, contact the doctor and do not perform a voiding trial. If there is vaginal packing in place, remove it before starting the voiding trial and document that it has been removed in the chart. If the patient has a foley catheter in place, remove it. Place a hat in the toilet in preparation for them to void later. When the patient gets the urge to spontaneously void, have the patient call the nurse to the bedside, assist them to the bathroom and have them void in the hat. Record this volume as their voided volume. Immediately after they void, check a post-void residual with a bladder scanner and record this as the post-void residual in the chart. If the patient has not voided within 4 hours from the foley being removed or from the end of their case, ask them to void. This is very important because bladder damage can occur if a patient's bladder gets too full and overdistended. If they are unable to void, then perform a bladder scan. Record voided volume as 0 and bladder scan volume as post-void residual. If post-void residual is over 150 milliliters, place a foley catheter. Check the voiding trial order to see if they need a smaller 12 French catheter, as this is used for urethral bulking patients. They will be discharged home with a catheter and have a repeat voiding trial in the office. If post-void residual is less than 150 milliliters, then they have passed their voiding trial and do not need a foley catheter to go home with. Please encourage patients to void every 4 hours. If at any time they cannot void or feel that they are not emptying well, perform a bladder scan post-void residual. Send the doctor the results of the voiding trial, and if you have any questions,